Hello and welcome back to another episode. I cannot believe it is episode 20. Can you believe 20 episodes? That's probably 40 hours of recording. It's insane to me that I've put a whole work week into this podcast. 6 months later, almost, pretty much, I think. Yeah, since October? And now it's March? That's wild, right? Just goes to show how time flies. But anyways, enough about me blabbing about my podcast. Just listen to the podcast, okay? This week, we're going to talk about nursing, specifically psych nursing, because as you may know, I have recently left the field of psych and transitioning into full-time pediatrics. But I just wanted to say that there's a lot that I've learned in my time as a psych nurse. It's only been 6 months, but there was a lot to be learned in that short amount of time. So let's get into it.
Qu'est-ce que je vais te nommer? Je vais te nommer l'amour, l'amour tendre, l'amour qui chante doucement dans mon cœur, l'amour sans logique à la raison.
So, one of the things that I love most about my job as a nurse is that I can do so many different things, and there's so many different fields that I can explore as a nurse. You don't have to just stick to bedside. You can do office work, you can do case management, you can do research, all sorts of things, and you can even try different specialties, throughout the hospital. And you can work with adults, you can work with kids, you can work with both, you can work with geriatrics, you can do so many different things. Nursing is such a diverse profession with so many opportunities and ways to learn new things and try different skills. So that's something I really love about nursing, and that's why I like what I do. And I think one of the most unique specialties, to be honest with you, is psych nursing. And obviously this is my opinion. You might disagree with me or think differently, but I have seen such unique things within the psych profession that I just want to share with you guys a little bit about what it looks like, okay? Because I think as an insider, I can tell you my experience, because there's a lot of obviously assumptions and things unknown about the world of psych, because honestly, it can be quite intimidating. Some people just don't take it seriously at all because they just don't believe in it. Some people think it's terrifying, which I agree with you. It can be terrifying, low key. Sometimes I have been scared for my life at work. And sometimes it's just really difficult because of the things you deal with, the things you see, the things that you hear from your patients. It can be really heavy. But I think overall it is a really beautiful field. It's much needed and it's growing, and we are improving. We're slowly making progress to make things better for everybody involved. The staff, the patients, everyone. I want everyone to one day look at psych and realize how beautiful it is, how helpful and necessary it is, and that we're doing a good job at meeting people's needs on both sides. Okay? On the nursing side, the workers, social worker side, therapy, everything. Everybody involved in care and the people being cared for. At this moment, I don't feel like I see that happening to the level that I'm comfortable working in it, so I'm taking a bit of a step away. I do love psych, don't get me wrong, but I have to be realistic about my physical strength, and my ability to get my ass beat is pretty high. Not my ability, but my chances of getting my ass beat, okay? I'm a, 5 foot something, 20 something year old woman. I can only do so much to protect myself, physically speaking. And unfortunately with psych, sometimes you see a lot of violence, and it can happen, and it's not necessarily because they're intentionally trying to come after you. They're literally in crisis, and sometimes they do not know any better. Sometimes it's behavioral, sometimes it's because they're in psychosis. There's so many different reasons for why people get hurt on the job in psych. But obviously it's no excuse. We still need to put precautions in place to protect our workers. And so when I see that happen, I think I would be more comfortable working in psych. But at this moment, I also think that I'm a better fit working with kids. So that's why I'm not working in psych anymore. But I will say that I really do appreciate my time in the field of psych. I've learned so much, and I've met some incredible people. My coworkers were amazing. They taught me a lot. And now that I've kind of graduated from the baby nurse stage, now I'm like 6 months in, I'm still technically like, I feel like I'm a toddler now, like I'm getting closer to like, okay, I'm getting a little bit more comfortable with my skills and with my clinical judgment. Obviously, I still have a long way to go and a lot to learn, but I just wanted to share some of my thoughts and knowledge and experiences working in psych, because I think it would be enlightening for people who don't know much about it or have been curious to learn a little bit more, or if you're a nursing student and you're contemplating working in psych, this might be a good resource for you. I will say the psych was one of my favorites in nursing school. Psych was one of my favorite clinical rotations, but I definitely noticed even then when I was at the psych hospital doing rotations, I connected better with the younger crowd, with the adolescents, with the kids. I did better talking to them than with the adults. And I think I just know that right off the bat, psych or not psych, I think I work better with kids. So figure out what you like, what age group you like, and if you like psych at all. If you do, I think you should go for it. I would say it's always an experience to be had. And if you don't like it, you don't have to continue doing it. That's the beauty of it. You're not stuck. You can try something else. But I would say if you're in the era of life where you're trying to start a family, especially for women, if you get pregnant, you're not allowed to work in a psych hospital. That they're just going to pull you off the floor, because it is, there's a lot of safety involved. There's a lot of risk involved, and you're definitely vulnerable when you're pregnant. So if you're thinking about doing psych, but you're already in the process of starting a family, I would wait till after that part of your life is done to get into psych, or do it before you do that, because I will say it's just too much of a risk to be doing it and pregnant. They wouldn't even allow you to. Typically. I'm not sure about every hospital, but I'm pretty sure every psych hospital, if they know that their employee is pregnant, they will not put you on the floor with patients. They'll probably have you do something else to keep you safe. Okay? Now, this is not to scare you. Obviously, people are in crisis, and so obviously the risk is higher, but you can get the shit kicked out of you in the ER on a med-surg floor. There was recently a nurse in Florida. She was beaten up pretty bad by a psych patient, but he was on a med-surg unit, if I'm not mistaken. And now she sustained pretty bad injuries, especially to her face, her bones, her brain is bleeding. And, obviously those are extreme cases, but I will say, it happens, right? I'm not putting any blame on her, because she didn't know what she was walking into. Nobody ever really does. But I would say working in psych, you usually have your guard up most of the time anyway. You kind of pick up on it and learn to watch your back. You do become pretty hypervigilant after working in psych. I will say, even when I'm not at the hospital, I am very aware of my surroundings. I've always been that way in general, but it's just kind of heightened, I guess, since I started working in psych. So I will say, you just have to be aware. You have to be smart, and you have to be really, really good at verbal de-escalation. Obviously nurses have different personalities, and some people work better with patients who are under, anesthesia, and they're better at assessing patients who are not walkie-talkie. And some patients, are more verbal and expressive, and some nurses prefer that. I think I prefer patients who are able to communicate with me, or at least they're not completely sedated. I think I just work better that way. I like talking to people, and I think I've improved on my verbal de-escalation skills. Obviously, they're not perfect, and sometimes those situations get out of hand on their own. Okay, you could only do so much, but it's definitely a cool skill that I feel like I've improved upon, because not only has it made me more confident to handle situations with just, strangers in public, or, in the hospital, obviously, when a patient is escalating, but also like even with my own family and friends, I feel more confident to speak up and to communicate effectively and calmly, because obviously I don't want things to escalate, right? When there's like a tense situation happening, I want to bring it down and bring it back to the facts, right? And have everybody's needs be met in the situation. So it's definitely a really cool experience, because it will teach you a lot in your own personal life. And obviously, here's the thing. Being a psych nurse is beautiful, because to work in psych, you have to have gone through some shit to understand what your patients are going through, okay? There's no psych nurse that I've ever met that had like a perfect life, no mental health issues. And I mean, to be honest with you, that's none of us really, like psych or not. Anybody who I know truly, we've all been through something in life, okay? And some of us have been luckier than others, okay? It takes a second for us to end up being a psych patient too. Okay, some people are straight up in crisis. Some people are genetically predisposed and they're struggling with mental health for the rest of their life, obviously. And, sometimes a psych hospital is just a safe place to stabilize them and maintain them for a little bit until they can get back to their normal routine. Some people go through a crisis. Everything was fine until it wasn't, and they didn't know how to handle it. And they just kind of, went into shock, and now they end up in a psych hospital for the first time. But I will say that it really helps to have some sort of empathy from your own experience. Obviously, don't bring it up. You don't have to share your personal life. Obviously, I would not recommend that because obviously with psych, you should maintain some privacy for your own safety. But I will say that your experiences will help you in terms of empathy and communication, understanding your patient. So that's another thing I love about psych is just, it's a very people-oriented field of nursing. Obviously, all of nursing involves people. But this is specifically a type of nursing where you can really connect with your patients on a very intimate, deep level in terms of, meeting them in their wounded place. People go through so much, man. And it's some heavy stuff. So I will say if you are easily bummed out and you're going to get burnt out in that type of profession, like I would not recommend. And honestly, taking breaks at times is necessary. I'm getting to that point where I need a little bit of a break. Just to take care of myself because it can get to me. I do go home crying sometimes. I do go home sad. I feel heavy when I am around people who are struggling. And I feel like I'm carrying the burden with them. So it is necessary to take breaks at times. So don't feel bad if it's weighing on you. Maybe you're a psych nurse listening to this and you're getting to that point where you're like, I don't know if I can do this anymore or if I'm able to handle it. Maybe it's just time for a break. Step away for a little bit. Try something different and come back to it when you're ready, okay? But I will just say that it is a very beautiful thing. I'm so grateful for every moment that I've had and all the people that have taught me while I was there at the psych hospital. It was great. It was awesome. And now I will say, it wasn't perfect. And I'm definitely excited for the next chapter of my life and for working with pediatrics. I think that'll be a good transition for me in my stage where I'm at personally. But I will say I'm open to going back. Who knows when that will be, but I'm open to one day going back to psych, maybe probably with kids. Just because I think I connect with them better. But yeah, sometimes you don't know until you try. You'll learn on the job as you go. So I would say if anybody is interested in working in psych, it is definitely very unique. It's very interesting, but just know where you're at with your own personal mental health. Know what you can handle. Make sure that if you do work in psych, you have routines that you can help yourself reset after a rough night. You have a support system, whether it's your family, friends, partner, a therapist that you can talk to because it's some heavy stuff. And you're already dealing with your own shit. Now you got to deal with like a whole unit of people who are struggling as well. And so it can be really heavy and it's important to have a way to release and to process. Or it's literally nearly impossible. Like take your meds, see your psychiatrist too if you need to. Okay. Because psych ain't for the weak. I don't know why people tell me the psych is easy, but then they won't work in psych. I've heard that like one too many times. It is not easy. Okay? It is dangerous. And it involves not only medical knowledge, but psychiatric knowledge. And half the people that I know who say that psych is easy don't know the name of a single mental disorder in the DSM. Okay? So don't come at me telling me it's easy when you don't even know what the hell you talk about. All right? Psych is not easy. It has been one of the hardest things I've ever done in my life. I'm grateful for every experience, but it's definitely challenging emotionally and mentally and physically. So, psych ain't easy. Just because you're not, running like 10 drips and doing vital signs every hour and doing neuro checks and all these things, like that's all fine and dandy and, everybody has their specialty. But I'm just saying that these people ain't for the weak. All right. Psych is hard. I don't ever want to hear that again. The psych is easy, okay? Because psych ain't easy. It is one of the most dangerous professions in nursing. And it's on the list of the top 5 hardest specialties in nursing, okay? Along with ER, ICU, and oncology. And I forgot the other one. So I'll get back to that list in a second. But psych is definitely worth it if you're a good fit for it, obviously. But not everybody is, and that's fine. I would just say, I just want some more respect for psych nurses because we do deal with a lot of shit, all right? People think we just, push pills and write notes, and that's not all we do. I mean, we have medical crises at the psych hospital. We have wound care, we have patients coming from all sorts of backgrounds, okay? All sorts of socioeconomic status. You have to learn how to relate to all these different people. It's a very people-oriented field. So a lot of talking is involved. A lot of communication is involved. A lot of medical knowledge is involved because you also see these are obviously, medications that we're starting them on. You have to know what's going to happen to them physically, not just mentally, but physically, what's going to happen to them, what to look out for, what are side effects. You need to know the origins of their mental health. Is it because of a neurological injury? Is it because they have a TBI or a brain bleed or some sort of accident that has altered their mind and their mood, their behaviors, their personality? I've literally met patients who have had a brain surgery or some sort of brain injury that have left them with lifelong depression and suicidal thoughts and mood and personality issues and behavioral issues. This is neuro, guys. It's just a branch of neuro, and people don't take this seriously. It is serious. Mental health is real, okay? Part of it is our lifestyle in this country. Part of it is our socioeconomic status and the opportunities we have available to us, our education, our food, our living situation, the traumas we've been through, our genetics. There's so many things involved in mental health. So I want us to be a little bit more mindful before we assume that, they're just a drug addict. No. It's because their parents fed them drugs since they were a child that they're an addict, not because they just one day woke up and decided to ruin their life. Oh, they're just weak because they don't want to live. No, maybe they've been through some shit you cannot even imagine going through yourself. Be a little bit more mindful of, our lack of empathy sometimes can cloud our judgment when it comes to perceiving other people. People have been through some shit. I've heard some stories that are unimaginable. I don't know how I would be standing if I went through some of the things that my patients have gone through. Okay? And some people just have the short end of the stick. They're just prone to certain things like schizoaffective or schizophrenia. Bipolar is really hard to live with. I mean, they're really hard. I mean, if it's hard to deal with these people. Imagine being that person. You're living inside their head. Okay? 24/7. That's all they know. That's all they feel. So let's be a little bit more aware and educate ourselves before jumping to conclusions about people who are struggling mentally. Okay? They come from all sorts of backgrounds. And it's not just the poor people who do drugs that end up in psych hospitals. I've seen patients with a good education, good family, and good jobs, a stable life, and still have crises every now and then, okay? So nobody is immune to mental health and disorders and trauma. It can happen to anyone. Just the same way anybody can get a cold, okay? The cold is not going to come for people who are middle class or something like that. There's nothing about diseases or pathogens or anything like that only affecting a certain community of people. A certain community might be more prone to it, but everybody is susceptible at the end of the day. I want you to think about mental health as like a microbe, okay? As like germs. Anybody can get the common cold or the flu or Ebola or COVID or whatever. Anybody can get it. Some people might be more prone to it based on habits and resources, right? But anybody is prone. So Anyways, that's my little rant about psych. But I just wanted to say this psych is such a beautiful thing. I really hope that one day I can go back when I'm ready. But at this moment, I'm taking a step away. And I had a little bit of an ego about it. When you tell people you're a psych nurse, they are low-key scared of you. And it's because they know you're a bad bitch. All right? Because you're strong. Physically and emotionally. Yes, I would say that obviously I am limited in my physical strength because I can only do so much. I'm a girl. I'm just a girl. But I will say I am pretty healthy. Okay. I take care of my physical and mental health as much as I can. And I also do the work to make sure that I don't end up in a crisis myself. All right. I do a lot of journaling. I go to therapy. I was on medication at one point. At this moment, I am not feeling the need for that. But I do go to my people when I need it. I do lean on my support system and do things that make sure I stay in check with myself. And that's the reason why I've been able to survive this long. Obviously, majority of the reason I'm leaving is just because I want to try something new. But if you're interested at all in psych nursing, I would say give it a shot. But just obviously consider your phase in life, you know. If you got osteoporosis, or you're just, you know, not very physically agile anymore, you know, due to age or however your health is looking, I would not recommend. Because you can get hurt real bad compared to someone who is not so at risk, you know. I would stick to something, keep yourself safe, all right? And obviously, if you're in the midst of starting a family, having children, things like that, probably not the best time to become a psych nurse. Obviously, you can become a nurse whenever, but a psych nurse is probably not your calling right now, just because if you get hurt and you have a family to take care of, you know, and there you got little ones or you're pregnant, definitely not the move, because there is obviously risk involved. But what I want you to take from this at the end of the day is psych is a beautiful profession. Not everybody has to do it. I'm just saying that if you do decide to do it, be prepared to take care of yourself and be really, I guess, self-aware of your own needs, because you're going to need to take care of your own things at home. Like you cannot just go to work and come back and not process what you've gone through at work, because it will catch up. So that's all I'm saying. But psych is great. And it's cool, and I think everybody should consider, you know, checking it out at some point in their career, because you're going to see psych no matter what. So even if you don't work in a psych hospital, maybe you work in long-term, like a group home type thing, or in the ER, ICU. A lot of psych patients end up there before they end up in the psych hospital for psychiatric treatment, because maybe they attempted to harm themselves. So you're treating them first, and you're going to need to know how to be empathetic and compassionate towards them as well. So it is really good to educate yourself on psychiatric disorders, and trauma responses, things like that. Just basic things. You need to know this stuff. No matter what kind of nurse you are, you need to know this stuff, because you're going to encounter it at some point. And it's okay to be a little bit intimidated by it. It's definitely not comfortable to talk about or to learn about, because it is very traumatic for everybody involved. Or it's a little bit odd. Like, you just don't know how to understand certain things. Like, sometimes when you're seeing someone responding to internal stimuli, hallucinating, talking to themselves, talking to the wall, like seeing shit, doing shit, like responding, that's definitely not everyday, you know, normal shit you see on the street. You know, you might every now and then, but people just learn to ignore it. But that's a person that needs help, right? That's a person that needs to be stabilized and get the right meds and think clearly again. So it's important to learn how to handle those things, because I guarantee you, at whatever point in your profession, you will see psych. You see it in labor and delivery. You see it in primary care. You see it in all sorts of aspects of nursing and healthcare. So I think it's time that we prioritize psych a little bit more. I really wish that we had more time in nursing school just to learn about psych, because it is such a huge part of our profession, no matter what field you're in. So I really hope that I sold this. I don't want to scare anybody, but obviously psych is dangerous. We can't pretend like you might not get your ass, but you most likely will at some point. Or at least get injured somehow, like more than other fields, but it can happen at any point in your nursing career, whether you're in psych or not. You know, we're not protected very much, unfortunately. So obviously, you know the risk that you're taking by becoming a nurse already. But I will say in psych, definitely expect some craziness, because duh, it's psych. But also, just be mindful, be aware of your surroundings, educate yourself, work on your verbal de-escalation, and obviously, sometimes nothing will work. Sometimes the only thing that works is, restraints or a hold and some shots or seclusion. We're working on that though. Obviously, psych is changing so much because this is a very newly explored field and we're coming out with research all the time. Things are changing rapidly. So obviously the way that we're going to approach psych in the next 10, 20 years is not going to look like how it is for the past 20 years, or even more than that, honestly. But we still don't know a lot about the brain, and we're learning a lot about that too. So in terms of neuroscience, it's important to educate ourselves on that as well. And also psych meds, because, it's chemicals that we're putting inside people's bodies, and it affects their brain and also their other organ systems. So anyways, that's just my little blurb on psych. I don't even know what to call this other than just like a Psych 101 episode. I really do hope that this enlightens you, gives you a little bit of extra knowledge about the field of psych. It's unknown and I really do love it. I'm gonna miss it. I'm not gonna lie. I already miss it a little bit, but one day maybe we'll go back. Who knows? But for now, we're just gonna work with the kids and see how that goes and see where it leads to next. Who knows? But with that being said, just know that whatever profession you decide, whether you work in nursing or not, or in psych or not, that you're doing a good thing and just keep at it. You know your strengths, you know your weaknesses, you know your calling. So just go with your gut, listen to your intuition, and live out your purpose. And thank you. A special thank you to all the nurses, especially all the psych nurses. Because without you, we would have a lot more people on the streets struggling, a lot more, dangerous events happening. And, I just want to say thank you to all the nurses that educated me as a baby nurse. And yeah, just remember, it's okay, baby girl. And I will see you next week. Goodbye.